Let's talk about the regenerative capacity of exercise. And if you stick to the end of this video, I'm going to address an important issue regarding the importance of having a balanced view about the benefits of exercise. We all know that the more we exercise, especially with certain type of resistance exercise training, the muscle mass increases. And in fact, there is a very real risk that as we go past 35 years of age, where most people reach their peak when it comes to muscle mass, bone density, strength, it's kind of downhill from there. The question is, how steep is the downhill? And in terms of muscle mass, sarcopenia is a real concern. Sarcopenia refers precisely to this phenomenon of losing muscle mass as we age. There's this generalized muscle atrophy to the point where in the elderly, which is the bulk of my patients that I see on a daily basis, you sometimes have people who can no longer get up from a sitting position because they are just too weak, and the risk of falls and not being able to get up after you fall to the ground is a really big concern in that population. And I often refer these patients to physical therapy for strength and balance. And it's not uncommon to see a skeptical reaction from them where they say, well, do you really think, doc, that this will help me at my 85 years of age? Maybe when I was younger, but now my muscles are not going to respond to this. And I often quote a study to these people where I show these researchers work in Chile, where they took a group of men and women in their 60s to mid-70s, and they compared them with a similar group of people that were older, over 80 years of age, 85. And they put them through a 12 weeks, 3 times a week, resistance exercise training program. Whole body, strengthen their muscles everywhere. They took measurements at the beginning, midway, and at the end of the program of their muscle mass, and they measured their strength with some standard tests. And what they found is that with this program, they could induce a 10% increase in quad muscle size and a 38 to 41%, I believe, increase in strength of the same muscle. And that is huge at that age. Almost like doubling the strength of the quad muscle in a population that sometimes has trouble getting up or getting themselves up after they come to the ground. That is absolutely huge. This is the regenerative capacity of exercise on the muscle. But it doesn't stop there. On bone, you have a similar effect where people who don't exercise lose bone mass quicker and to a more severe extent than those who exercise. And again, I have many patients, especially females, after they go through the change through menopause in their early 50s for most women, and the estrogen hormone levels drop significantly, the bone density suffers. And it's unfortunately an age where a lot of these patients don't move as much. They slow down. And in 10, 15 years after that, when we do the first bone density test for screening, the first DEXA scan at 65, we oftentimes find osteoporosis, which is simply a fancy name for a degree of bone loss in their hip bones, in their lower back, sufficient to majorly increase the risk of a fracture if they were to have a fall. You may think in this day and age, what's the big deal? You have a fracture, you heal. Well, if the bone is weak, the healing is slower, you can break it again. It's not a pretty picture. And in case of the back, at least, when you have those compression fractures and the spine shrinks and squeezes those nerves in your lower back, a simple compression like that can give somebody terrible pain, no matter how they sit or what they do, for 3 months continuously. So it's a big deal. Weight-bearing exercise, such as walking, and if you can include some jumping, talk to your doctor, make sure it's safe for you. It's even better has been shown to significantly increase the bone density in the big bones in your back, in your legs, and elsewhere. Now, I promised you in the beginning that I would address a balance issue, because sometimes people listen to presentations like the one I just did and others that are even more enthusiastic on social media and elsewhere, and they hear, yeah, weight-bearing exercise builds bone, and they go home thinking that that's all they need to do for their osteoporosis. And for some it may work, but for others it doesn't. And I want you guys to have that balanced attitude where nobody is immortal. We all owe one death, as a Romanian poet put it. What we try to do here is to find and implement as many measures that would improve somebody's bone density as possible. But we're not claiming here that this works for everybody and there is 100% bone density improvement to your 35-year maximum in all patients. These are helpful measures, but they all have limits. And there's a place for pharmacotherapy, for drug therapy, for hormonal therapy, and other things like that, and consult with your doctor. So keep that in mind, please, as we discuss these issues. You stay healthy, you stay happy, and you stay active, my friend.